In this video, we will talk about facts and fiction around lumbar disc herniations. Hi and welcome back to Physio Tutors. Hardly any musculoskeletal topic has received as much media coverage as herniated discs, and probably every person knows some family member or neighbor who has had one. At the same time, a lot of misconceptions have been spread about the topic, and a lot of patients suffering from low back pain fear that they herniated the disc. We've decided to aggregate the research surrounding lumbar disc herniations to separate facts from fiction. Let's first have a look at the anatomy of a lumbar disc. An intervertebral disc consists of strong fibrocartilage designed for shock absorption and is firmly anchored into the vertebral bones above and below by the vertebral end plates. Furthermore, it is surrounded by strong ligaments, so there is absolutely no way a disc can slip. So what is a disc herniation then? Herniations are broadly defined as a localized or focal displacement of disc material beyond the limits of the intervertebral disc space. The disc material may be the nucleus, cartilage, fragmented apophyseal bone, annular tissue, or any combination thereof. First of all, the presence of disc tissue extending beyond the edges of the ring apophysis throughout the circumference of the disc is called bulging, and it's not considered a form of herniation. There are three categories of disc herniations. We are talking about a disc protrusion, if the greatest distance between the edges of the disc material presenting outside the disc space, so the D line, is less than the distance between the edges of the base of that disc material extending outside the disc space, which is presented by the B line. In an extrusion, the D line is bigger than the B line. And in a sequestration, which is a subclass of a disc extrusion, the extruded disc material has no continuity with the disc of origin. It's important to realize that disc protrusions are very common, also in healthy people. A famous study by Kai et al. In the year 2015 showed that almost 1/3 of healthy 20-year-olds have a disc protrusion. The number increases with age, up to 43% at the age of 80. So almost every second person without low back pain has a herniated disc. Disc bulges are even more common, by the way, with 84% at the age of 80. So even if your MRI scan does show a bulging or protruding disc, you should realize that these findings are completely normal and much like gray hair from the inside. Pain is complex and cannot be explained by an MRI scan alone. Let's see what the evidence says about risk factors to be hospitalized due to a lumbar disc herniation irritating a nerve root. In a Chinese study by Zhang et al. In the year 2009, report that family history, so genetic predisposition, was by far the biggest risk factor. This was followed by lumbar load at work and strenuous work, while regular physical exercise and sleeping on a hard bed were both protective. Furthermore, a study in Swedish construction workers and 2 systematic reviews with meta-analysis revealed that smoking, obesity, and overweight, as well as being taller than 1,90 m or 6'3", are further risk factors. An interesting literature review by Belavi et al. In the year 2016 showed an increased risk for lumbar disc herniations in astronauts after returning to Earth. They concluded that the most likely cause thereof was a swelling of the intervertebral disc in the unloaded condition. Conclusion: intervertebral discs need load to stay healthy. Not surprisingly, studies from Bowden et al. In the year 2018 and Belavi et al. In 2017 also show that physical activity, particularly vigorous activity and running, are beneficial to maintain intervertebral disc health. Okay, so let's say you or your patient are one of the unlucky ones who experience sciatica from a herniated disc pressing on a lumbar nerve root. How long does this take to heal? In a Dutch study by Vroemen et al. In the year 2002, 73% of patients showed major improvements at 12 weeks without surgery. On long term, Constantino et al. In 2008 found a less positive course, with 55% of patients reporting improvement of sciatica after 12 months. For some reasons, a lot of patients assume that having a disc herniation is something they will have to live with for the rest of their lives. However, a study by Alcoli et al. In the year 2019 followed 9 patients with lumbar disc herniations and sciatica. Spontaneous resorption of the herniated disc was found in all patients in a mean time of around 9 months, while they recovered way earlier with a mean of roughly 6 weeks. This shows again that you can recover although you still have a hernia, so structure is just one component of many influencing someone's pain experience. By the way, a larger and/or sequestrated discs were associated with an even faster resorption. A meta-analysis from Song et al. In the year 2017 confirms these findings, showing that spontaneous resorption was reported in 66% of patients across 11 different studies. So, a herniated disc and sciatica do not necessarily mean that you need to get surgery. In the Netherlands, about 5 to 15% of patients with lumbosacral radicular syndrome end up getting surgery. But how effective is surgery? A systematic review by Jacobs and colleagues in 2011 showed that conservative treatment and surgery are equally effective after 1 and 2 years. The only advantage that surgery might offer is a faster pain relief for patients with 6 to 12 weeks of radicular pain. However, other options for pain relief should be considered first, such as NSAIDs, weak opioids, or epidural injections, like the NICE guidelines from the UK suggest. While surgery or just time usually improves a patient's leg pain, a lot of patients we see do not improve their back pain. Probably the main role for us as clinicians in these cases is education and reassurance, possibly by showing them our video, and by helping patients to regain confidence in their backs. This can be achieved by a graded activity or graded exposure program to challenge specific movement-related fears, such as bending over, for example. If you need some inspiration for that, check out our video in the top right corner.